And you guys need to buzz us if it's like if we're like too slow or you're sleeping. Okay.
Notice forehead posture.
Okay.
Little rounded, little kyphosis.
Okay.
Thoracic side.
Good. Pain's probably where?
In between the scapula, so I'd say like T5 to T7 area.
Okay. She right or left-handed, Alex?
I assume right-handed.
Okay. You right or left-handed? Right-handed. Okay. So she's gonna have right pain or left pain? Which one is longer and weaker? Typically. Dominant side. Where's your pain at?
Right side.
Right side.
Right, like a little medial.
Medial to the scapula. In Dutton, what was that called? Imaginese. Something. It's actually kind of fake, actually, when you look at it now. So just know that that might be a diagnosis that's sent out there, but it's that trigger point at T5, right? T4, T5, T6. So, all right, good. When's your pain worse?
After setting.
Prolonged sitting. Okay, you're next.
For core activation.
Yeah.
I have two.
Okay, good. Jenna Banks.
She doesn't have very much spinal curves and sitting.
Okay, all right. How do we reproduce our pain? So that's what's hard, right, in your eval, because it's a prolonged scenario, right? So am I going to make her sit in my eval for 2 hours? Why not? Okay, right? So can anything else that aggravates it?
I just feel like a physiological like pop it.
Pop. Okay, need to pop it. So what would we do for her? Totally. Okay, good. All right, good. Give it to me.
Yeah.
Okay.
I'd like to watch how they're breathing
Good.
too.
Yeah.
So she's not doing diaphragmatic breathing at all, right? She's all accessory muscles.
Yeah, and she can. She's sitting slump. Totally. Good. Like it. Okay. What else? You're up, Christine.
I would just want to ask if she takes any breaks, like while she's sitting, what she does to alleviate the pain.
What do you do to alleviate the pain?
I know, like a lot of times, kind of just like deal with it.
You know, I think you're at a physical therapy school with these things called foam rollers. Not really sure.
I started on
But
the floor and I found a physio ball that helped.
yeah. Okay, good. So you change your services. Good. Okay. You work out?
Yeah.
Work out. Okay. What do you do?
I got my keys in cardio.
Alright.
I've been trying.
The shop. The shop.
I've been trying to work on road.
Okay.
It's a new thing now.
Good. Okay, so lifting weights, so we're gonna wanna support that, right? So in our clinic, we're gonna wanna do some weightlifting. Good job. So we know she's not opposed to it, okay? How else can I reproduce her pain? Neil, what do you think?
Maybe ask her to get some positions that cause the pain
Okay, maybe. She's in it,
right now.
she's in it, right? Okay, but it's probably a little worse after time, right? Okay, so full slump, right? Okay, but it's a time-dependent issue. So how else, Chad?
PAs.
PAs, maybe. Okay, good. Jenna Banks, what do you think? Is it on her spine? It's between her spine and her what? Medial border of her scalp. Okay, so what's there? Muscles, good. Future doctors. Okay, good. Andrea, what else? Fascia, good. Christine?
There. So,
Whole bunch of ribs, whole bunch of nerves.
Joints.
Okay, yeah. Okay, good
Intercostal
stuff.
muscles, maybe.
So, Russell, how would you reproduce her pain?
Well, I would have her do some active motion. I think first we can make things worse and then try to make things better.
Yep.
I think the first thing I'd try to make her do is just take a big deep inhale and see if things got worse. And if she did that and it was reproducing her pain, she might have some intercostal strain or some rib dysfunction, right? If it didn't, then I can kind of rule that out, so that's a good thing.
Good. What else would you do, Kimberly?
I'm gonna have palpable.
I would push on it. Really, like right away, okay? Good deep breath, love that, okay? But really I would come up and go, she's trying to point in there and I wanna feel, if I can feel it, like there's her pain, okay? So now I might see if that pain, same pain comes on with that deep breath, but I don't think it will. Most of the time with that, she doesn't really have any type of mechanism of injury, that kind of thing that she's complaining of. She's just a student and it's really tight in here, okay? Do you think that we would do active range of motion and rims on her upper extremity? I totally would actually. Yep, because in this posture and with dysfunction, do you think she's gonna be strong or do you think she's gonna be weak? She's probably gonna be weak, and that's a cool party trick because you fix her. Here, you maybe manip her, do some soft tissue, you retest her, maybe you get into that diaphragm, free that up, get into her pecs, free that up, okay? Give her a few exercises, retest her, and now she's strong, okay? So is it a neuromotor issue because of this postural dysfunction? Totally, okay? So I would totally do that actually. I don't need to do all of them, right? But I would do most of them, okay? Go through it quickly. What are we gonna do for the cervical spine? Yeah, clear cervical spine. And is she gonna get increased tension into that area when she goes into that deep cervical flexion? I would expect her to, right? Okay. But if I have her sit up and go into deep cervical flexion, it might be less. So now I've just taught her what she needs to do to help herself when she's studying as well, okay? What do I do, Christine? How do I test her range of motion for her thoracic spine?
Range of motion for thoracic spine. So you do into extension.
Okay. Andrea, you want to help her out?
Range of motion with inclinometer for flexion, extension, and side bending.
Yeah, where's that inclinometer? Do we have those? You got it. What do I need to lock down? Yep, how do I do that? Yep. Oh, I can't do it. I don't have the range. It's fine. Just cross it your ankles if you need to, or cross ankle over your knee. Okay? Doesn't really matter. Where am I going to have her put her hands for flexion and extension? What do you think, Jenna Banks? You weren't going to say that. What were you going to say?
Flexion, extension. I mean, drivers too.
Yep, so you're gonna come here, okay? You're asking them to bring their elbows together and then tuck down towards their belt, okay? If I just fold forward, what am I really testing? Lumbar, okay? So it's here, and that way if I had to do overpressure, now I'm just preset to do it, and now I can get that good fulcrum into that thoracic spine, okay? You're going, that actually felt kind of good, like I want you to keep doing it. Okay. Okay, so we would do that on her. How am I gonna test rotation and side bend? Yep, across here, okay, for rotation. Yeah, so now I can come in this way. Okay, good, and then go the opposite, right? Okay, test it out. You guys see how it gives a little overpressure at the end? We wanna see what your patient can do, but you're gonna go right into your overpressure, especially with thoracic spine typically, because they're not complaining of that sharp stabbing pain unless we think it's discogenic in nature. But you wanna see what their infield feels like, okay? For side bend, you're gonna come this way, okay? Can you do it differently? Do you do side bend this way?
I
I rarely do side bend.
Here, and then I'll do overpressure, just pushing.
That way. I like that way better. Okay? Okay? So you guys are gonna go practice that right now.